So the United Nations Population Fund says that it's running out of money and they're going to start scaling back maternity services in Yemen. The UN's Reproductive Health Agency was facing a funding crisis even before the coronavirus pretty much upended the world. And now the situation is particularly dire. CBS News reporter Haley Ott has more on this.
For these mothers and children in Yemen's Al-Makha hospital, help came just in time. But for tens of thousands of others, soon there may be nowhere to turn. The United Nations Population Fund, which runs maternity services across Yemen, says they've run out of money. Now they'll have to start scaling back services, potentially cutting off hundreds of thousands of pregnant Yemeni women from receiving medical care. And the coronavirus is making things worse. Nestor Owomohanji is the country representative for UNFPA in Yemen.
And so in terms of mortalities, which were high, the highest in the region and one of the highest in the world, we certainly envisage that these are going to be higher. And that's even before we talk about the further closures that we're anticipating in the coming days.
Years of violent conflict has crippled Yemen's health system. Already, only about half of the country's hospitals are open and operational, and only 20% of those offer maternity care. If this disappears, UNFPA says an additional 48,000 Yemeni women could die during childbirth.
Our motivation is actually the hopelessness of the population. The people we deal with, looking at how hopeless they feel, somehow motivates us to carry on.
UNFPA says it needs $59 million to keep operating in Yemen until the end of the year, and another $24 million on top of that to deal with the coronavirus. So how long Owomohanji will be able to carry on depends on the depth of donors' pockets. Haley Ott, CBS News, London.